This is an unprecedented health crisis which has already killed thousands of citizens. It has hit our economies and our societies very hard. People have seen their lives and their daily routines being turned upside down. It is thanks to them, to their patience, to their huge sacrifices, that we are now have entered a period of stabilisation in the majority of member states. The possibility to gradually resume travelling and tourist activities, to visit family and friends, will be a clear sign to citizens that these sacrifices have not gone to waste. But the battle has not yet been won. As long as we do not have a vaccine, the virus will remain with us, and the risk of infection will remain. This is why it is crucial that we take a gradual approach and that we accompany the resumption of travelling and tourism with rigorous health security measures to make it as safe as possible. We, of course, do need to open our economies and our societies, but our main priority must remain to protect public health. We cannot risk an uncontrolled resurgence of the virus. With over 1 million cases of the COVID-19 in the EU, we cannot afford to lower our guard. This summer will not be a summer like all the others, and we are going to have to adapt to a new reality. From a health perspective, several important criteria have been put together with ECDC to allow the gradual return to tourism activities in the coming weeks and months. Firstly, all the number of COVID-19 cases must have significantly not only declined, but also stabilized in regions and countries wishing to reopen travel and tourism areas. We need clear evidence confirming this situation. Secondly, countries and regions must ensure sufficient health capacity systems, such as hospital and intensive care services, in case the number of cases suddenly increases. And access of healthcare must be guaranteed to everyone, including visitors from other member states. Thirdly, member states must ensure sufficient testing capacities and to test on a large scale to detect new cases and changes in the spread of the virus. Fourthly, this should be coupled with contact tracing, for which coordination between member states will be even more important as borders reopen to ensure cross-border control of virus transmission. Fifth, communication will be key, and citizens should be informed of the measures that are in place for their protection and the precautions that they can take to be individually safe. And lastly, comprehensive preparedness plans should be put into place very quickly to react to any outbreaks that occur. Part of this is guidance on the rigorous health and safety requirements needed to allow people to stay safe, as well as work within the tourist sector, in hotels, in restaurants, in outdoor areas. We are today setting out the framework of how member states can resume traveling in the safest way possible, and how we need to rethink of tourism in the future. Putting this in place and doing so in a coordinated way is their responsibility. A precondition for any resumption of travel is the lifting of internal border controls and ensuring transport which is as safe as possible across the EU. For this, I now have my colleagues here with me, Ilva and Adina, to be able to take up these 2 points. Thank you.